All right, welcome here, everyone. I am just getting set up. I've got PowerPoint here that this is my first time trying a PowerPoint. So we're going to make sure things are working. It looks like they are. And I want to bring a couple more things up here as we're getting ready. So welcome to the Kick the Sick webinar. I know this time of year with winter coming up is the common time where people are getting worried and nervous, and so many things that are happening. It can be challenging this time of year because you know based on years past what you might be in for, and that's what we're going to talk about today. If you're here with for yourself, or most likely a parent for your child, and you've been struggling in years past, I want to help you make this winter different. So I've got some PowerPoints here. My video should be down low. I know a lot of people that are watching this webinar are actually going to watch the recorded version. So I just want you to know, if you are watching live and you want to ask a question, feel free to comment and post that question. If you're watching this in the recorded version, feel free to comment as well. We will be keeping track of those comments. So if you have questions that you don't get to ask during the live version, definitely still reach out, post those in the comments, and we're still happy to answer them. So let's jump in here. I know that, as I said, this time of year can be challenging because if you're watching this, you're probably not watching this with a child who gets sick a couple times a year and you want to shorten their cold from lasting 5 days to 3 days. If you're watching this, your child probably gets sick a lot. Or maybe they get sick and they never seem to get better. I had one little girl come to see us once, and family brought her in. She's about 4 years old. They brought her in March, and they said, yeah, basically she's had a cold since last October. So we deal with some of these challenges a lot, and I know it's so tough for you as a parent. Or maybe it goes beyond just the cold. We see a lot of families who, when the cold comes, they know it's going to go to an ear infection or a sinus infection, or as soon as it starts draining into the lungs, it's going to turn into croup or pneumonia or bronchitis or something more severe. And as a parent, I know that's especially frustrating when you can see this progression coming, when you know, like, oh, here it comes again. And I remember when I was a kid and I would get sick and my mom would be snuggled up with me on the couch, and it would really be some of it would be nice because she would say, like, I get to spend some time with my kids, my sister and I know she loved us so much, and she certainly enjoyed cuddling with us and snuggling with us. But also I know it was so frustrating for her because maybe she was missing work. Maybe she was paying for daycare at that time, and although she was paying for daycare, we were still at home with her. And while I love the snuggles, I know she was also missing out on things to get done in the house, getting behind on cooking or taking care of all the other pieces it takes to run a family. So if you're going through some of those struggles, definitely know that we can relate. We know it's not easy. We know that it's frustrating, it's exhausting, it's tiresome, and most likely that's why you're here today. So what we're going to discuss is really, while this may be so common for a lot of families nowadays, it doesn't have to be that way. It doesn't have to be the normal. And what we're going to talk about is how the potential could flip, how it could actually be a brighter and happier future. And so what I want to describe today are some different strategies, just so you know who I am. If you haven't seen me on Facebook here before, or haven't seen any of our webinars or seen us in the office, my name is Dr. Taimo. I own Whole Family Chiropractic and have been in practice for 11 years. And one of the most common things that we get good results with is immune system. So if you're wondering, why is a chiropractor talking about my kids' ear infections, or their strep throat, or chronic sinus infections, or lung issues, whatever it might be, just know that it's something we get great results with. So I have a lot of expertise in this area. I'll talk a little bit more about that in the end. But for the focus right now, I want to talk about 3 different things. Number one, I think it's so important to understand why some people get sick and others don't. That's going to be a foundation for the rest of this webinar, so we're going to start with that. Then we're going to go into some of the common things you might see on the symptom side of things, whether it's a cough that's so annoying, or a sore throat, or a fever. And as a parent, you might be wondering, all right, how long do I let the body do its thing versus when do I step in? When is it safe? When is it not? And talk about why the body is doing these things so you know best how to support it. And then the biggest thing is, what can you do to prevent this cycle from just continuing and continuing? as I said, so many people that see us, it's not because of the occasional cold or flu. It's because this cycle is so continuous and so repetitive, and you feel almost like you're trapped. Like you could wash your kids' hands 20 times a day and carry the bottle of hand sanitizer around and wipe everything down with a disinfectant wipe, and yet it's not making a difference. So why is that, and what can you do about it? So let's jump right in here. And I think the biggest thing, as I said, that I want to set the stage for, so you know where we're coming from and you know best how to approach your child, is why do some people get sick and others don't, right? If you go to a daycare and there's coughing and sneezing and stuff going everywhere, you know those germs are being spread around everyone. Or same with the school and the classroom. And sure, a lot of kids might get wiped out, but there's always a few that seem to survive. There's always a few that it seems like no matter how bad it is, they rarely get it. Or maybe you notice that even within your own household, one of your kids is always sick and the others always seem to do fine. So what's the difference? Well, I was thinking about this the other day when there were all of a sudden in our condo where my wife and I live, some fruit flies appeared. And I got to thinking, well, these things are really annoying, but they got to be here for a reason, right? So I get up, go over, I walk to the fruit bowl, and sure enough, there's a couple bananas in there that are gone a little past their ripe date. And when I started thinking about this, I thought, well, all right, well, how did the fruit flies get here if they weren't here before? They're obviously really annoying, right? So I was kind of swatting at them and trying to kill them off. But as long as the rotten fruit was there, they kept coming back no matter how much I worked to try to kill and smash those annoying flies. And so I realized that, well, were they like flying by my window and they saw rotten fruit and they just flew in and landed there? Or was my fruit really fresh to begin with and they landed on it and caused it to be rotten? And I started to think, well, the only time I've ever seen fruit flies is only when there's rotten fruit. I've never seen them with fresh fruit, and I've never seen them like before the fruit was rotten. So it made me realize that the only time fruit flies appear is when my fruit has already gone bad, when it's already turned the corner. And I realized that this is so crucial with your body as well. Sometimes we want to blame the germs, and we want to keep killing the germs and killing the bugs and getting rid of the bugs. But we forget about the only time those bugs are going to appear is when our body is weak enough to allow them to appear. So let me give you an example. One of the women that we saw, a young woman in her 20s, she started seeing us because she was getting sick all the time. And not only with colds, but she would have strep throat multiple times a year. And the doctor said, if you keep getting strep throat, you're going to have your tonsils out. And she said, there's no way I'm doing that. I don't have time to afford it or money or whatever it is. And she said, I got to do something about this. And initially, she blamed her sickness on where she worked because she worked in a daycare. And as in a daycare, as you probably know, there's kids with germs, right? And the bugs are flying everywhere. And she kept getting sick over and over and over. She thought because she was around these germs all the time. Well, she came to see us. She started getting adjusted. And she started getting adjusted in early fall. We go through the winter, get into spring. And in about March, she comes into the office one day and she gives me a big high five. She goes, Dr. Ty, thank you. And I say, well, for what? She said, I just made it through this whole winter without getting sick and with getting strep throat 0 times. And I was super excited for her, as naturally we get excited for our practice members that do well. But here's the crazy thing. She didn't change where she worked. She didn't change anything on her outside environment. She was still around kids. She was still around germs. The only thing she changed was how strong her body was on the inside. So I really want to emphasize this point, is that when you're dealing with a kiddo with chronic repetitive issues, is you can only a lot of times get so far by trying to kill all the bugs on the outside. And the biggest thing is, what can you do on the inside? And that's what we're going to talk about today. Before we do, there's one quick study here that I want to mention that really emphasizes this point. So it's by this book by Deepak Chopra, a great book called Quantum Healing, and there's an excerpt in there talks about a study they did where they took a cold virus and they incubated it, and what they did is shoved it inside people's noses, right in the mucous membrane where it could really kind of sit and take hold. So the question was, of all the people that got this cold virus shoved in their nose, how many actually got sick from it? And it really surprised me because it was only 12% of the time. That's about 1 in 8 people actually got sick, even though the cold virus was directly put in their nose. So that's what I said is what matters more than the bug is what's going on inside your body. So let's talk about that. So I want to mention a few of the common things, as I said. So we'll start with the coughs, the sore throat, the fevers, even the moodiness, because I know that's not fun, what to do about it, and how to know where to draw the line, and also how to support your body. As we're going through some of these different things, I want to talk about then what can you do now to help your body or your child's body get stronger for next time. So as we're going over these different symptoms, whether it's a cough or a fever, whatever it is, the biggest thing to keep in mind is always ask yourself, what is the body trying to do? Because I know from personal experience, when I'm sick, I feel like crap, right? When I have a sore throat and I can't swallow very well, it sucks. When I'm so tired I just want to lie down, or I've got a fever or chills, whatever it is, I don't feel very good. And I know it's really uncomfortable. But I've learned over the years to always ask, well, what is my body trying to do with this, even though it's uncomfortable? Think of it as if your house was on fire and the smoke started filtering down the hallway and it hit the smoke alarm. Would you want that smoke alarm to go off? Of course you would, right? Because it could save yourself and your family. Well, the smoke alarm, when it goes off, it's really annoying. We understand that, but it's there for a reason. So the same for these symptoms in your body. So let's start with the cough piece. Now, coughs are especially annoying because there's times where your kid's going through the day and they're not coughing. You think, well, that's a good sign. Hopefully they're done with this and maybe they're going to get out of this sickness, whatever they're in. And then they lie down at night and there it goes. You hear from the other room, right? And you know your child's not going to sleep with this annoying cough. So let's look first at why does this happen? Well, we know that your body's not just going to cough for a random reason, right? So when you have a cold, what usually happens is things start up here, right? Maybe you get some puffiness under your eyes, you get a sore throat, you get some sinus pressure, things that start to hurt. This congestion starts to build up. And all this inflammation and congestion is because your immune system is dumping all the reserves up into that area to try to fight things off. Now, what should happen is all this stuff should start to free up and it should start to drain, right? And it's not very comfortable as it starts to drain, but the reason is if it stays stuck up here, you're more likely to come down with a deeper infection, right? If the fluid and all that stays stuck in the ears, your child is more likely to have chronic ear infections. If it stays stuck in the sinuses, more likely to have chronic sinus infections. So it has to drain out of there. And as it starts to drain, it might go into the throat, maybe the tonsils and the adenoids. There's immune responses that happen there. Maybe they can help out with some of it. It drains into the lungs. Well, there now your body says, I don't want it sitting in my lungs. I got to get it out. So when you're upright, gravity's pulling everything down. It doesn't make much sense to do all your coughing when you're upright. So you lie down at night, and now because you've gone from upright to flat, now that fluid can get back out easier, and your body is smart enough to know, well, if I cough while I'm lying down, I'm going to have gravity actually kind of helping me instead of hurting me and help get things out. So the biggest thing to keep in mind when you're looking at coughs is when are they productive or when are they not? Hey Jessica, thanks for waving hello. Glad to have you on today. If you have any questions, type them in the comments. I'll make sure to answer them. When we're talking about coughs here, is when are they productive? Well, if you're getting that real dry, kind of irritating cough, what that might mean is your body's starting to prep. It knows things are maybe just starting to drain, and it's getting ready to get it out. Now, if you have that kind of deep, mucusy, phlegmy cough, that's when you know your body's actually doing exactly what it's supposed to do. Because all that gunk that just drained still has to get out. Maybe sometimes you cough and you swallow. I know it's not very fun. Sometimes it's kind of disgusting. But even when you swallow, it puts it into your stomach, which is full of a bunch of acid to kill all those bugs. So as long as the cough is productive, I'd rather see your child getting it out than letting it stick in there. Even though they might not sleep as well, a lot of times what I find is maybe that early part of the night is where the coughing's most intense, and then things do settle down so you can still get a good chunk of sleep afterwards. But if that cough is productive getting stuff out, you know your body's on track and doing what it's supposed to do. Now, if the cough starts to get too extreme and there's times where it can kind of tip and get sort of worrisome as a parent. If it's maybe really wheezy, and you start to wonder, well, is my child like getting enough air? What's going on here? There's one thing that I would recommend, and I would have you talk to your doctor about this. I'm going to put in a disclaimer that I will not be the one giving professional advice, but it can help to see where your oxygen is at. So if you're worried about how well your child's doing, if they're getting enough oxygen, because that's what the lungs are designed to do, is this thing called a pulse ox. And what it shows when you put your finger in, it actually shows the percentage of oxygen in your body. So the cool thing, these used to be really expensive, but now they're super common. If you have one of these at home, I would talk to your pediatrician and just kind of get a baseline. Well, it's supposed to be generally in the mid to high 90s. If it's dropping below that, you know that oxygen might not be getting to your bloodstream enough. So keep that in mind as a way to know, like, all right, is this cough going too far, or is the body holding up with it okay? So a pulse oximeter is what it's called, and super easy to get off Amazon, and talk to your pediatrician about that if you're worried about coughs. So the next thing we'll touch on just briefly here, the main one actually after this is going to be fever. That's the main thing that I want to touch on, because that is often where the parents have the most concern, but also what might be the keystone to really getting your child healthy in the end. So first of all, sore throats. Really what's happening with a sore throat is, think of it as inflammation, right? A lot of times a sore throat might be happening early on in a cold if there's maybe a virus back there and the tonsils, the adenoids are starting to swell. And anytime there's inflammation, the body is putting healing energy into that area. So a lot of times we talk about inflammation as being bad. And yeah, if it's chronic, if it's always there, if you're always eating foods that trigger inflammatory reactions in the body, that might be the bad situation. But on a short-term basis, inflammation is the body's healing response. If you've ever sprained an ankle and it swells up, it's because that swelling is putting all these fluids and nutrients and repair molecules into that area to help to heal as quick as possible. So the immune system actually has a lot of inflammatory responses as well, because what it does is it puts extra blood, especially the white blood cells, where the immune system, the different parts of the immune system, and they're there to help try to kill things off. So sore throat can be one of the most annoying things, but just so you know, that inflammatory response is actually there on purpose for a reason to help kill things. Now, to keep in mind, if you can start to soothe it, great, like maybe some tea with honey, anything that helps soothing, because one of the key factors in no matter when you're sick is getting enough fluids in. And especially if your child, if it hurts to swallow, they're not going to want to be drinking a lot of fluids. So warm fluids, we drink a lot of bone broth in our house, teas, anything that's warm is easier, and the honey, like I said, can be a nice way to coat it. Anything that helps to coat to get fluids in is going to help get through that scenario. Just touch on briefly, obviously strep throat is a super common concern. You can hop online, you get some of the key things of when to look out for strep throat. And that's probably the one situation where, yeah, it's okay, you know, to go in and get a swab, get checked early just to make sure you know what you're dealing with. So let's go on to fevers. As I said here, this is what I want to spend a little more focused energy around, because it's often where you as a parent might have the most concern what to do about it. So as I said in the beginning here, the body is only going to do things for a reason. So sometimes when we see a fever, we think, oh, we got to lower it right away. But let's take a step back and actually talk about what is a fever there for. So a fever is designed to do a couple things. Number one is when you raise the body temperature, it helps prevent certain viruses and certain bacteria from being able to multiply. See, a lot of viruses and bacteria, they invade a body because at the normal body temperature, they can survive really, really well. If you bump the body temperature up a few degrees, maybe it goes up to 102, 103, now those viruses and those bacteria say, oh man, this wasn't what I was hoping for when I invaded your body, and they can't multiply and survive as well. So number one is it helps prevent them from really taking hold in the body. And then the second thing that a fever does that a lot of people aren't as aware of is that it's one of the early responses the immune system uses to tell the immune system, get going. You see, whenever a bug invades the body, actually, let me take a step back. So for the immune system, before it invades the body, there's one part of the immune system that tries to prevent that from even happening. And once it's in, there's another part that takes action. So this part on the outside that helps to try to prevent things from taking action is things like our skin. If we get a cut, obviously there's a direct route to our bloodstream, more likely to get infected. Our skin's very protective. In our airways, in our nose, in our mouth, and anytime we breathe something in, there's actually little parts of the immune system right at the surface there that help to kill it off. I mentioned before in our digestive tract, there's things like the stomach acid are actually part of our immune system to prevent bugs from getting very deep inside our body. So if there's something on that surface level that we can fight off right away, usually you don't even notice a thing. What happens though is if it gets in deeper, now you have to have these soldiers of the immune system really start to take action. So a fever is almost like the warning bells going off. If you think of like a fire department and all the firemen are just kind of hanging out and they're relaxing and they're just kind of lounging around, they're waiting for a fire, right? And all of a sudden the fire bell goes ringing, they jump up and they take action. Well, the same for your immune system. Your immune system wants to rest if there's nothing to do, but as soon as there is something to do, it wants to know about it right away. And when your body raises a fever, it actually is like ringing those fire bells to get all the immune guys out and active and taking action. So a common pattern that we see in our office is kids might come in with this low-grade fever. And it might be low grade for a couple reasons. Number one, maybe they're taking some Tylenol or something and they're keeping it lower. And just so you know, I'm going to address here in a little bit the safety of fever because I know that's a big question. But before we do that, I want to explain what the fever is doing here. So we have this low grade fever and it feels like a child is just kind of staying kind of sick, right? And they're not like horribly uncomfortable. They're not really melting down, but they're just got this chronic runny nose, we'll say. And so what can happen is because the fever never got to rise up high, the alarm bells never went off. So the immune guys in the body, all those little firefighters, they're just kind of hanging out. They're not really very active. And so this cold just lasts and lasts and lasts. What will happen when kids come in for their adjustments, one of the things the adjustments do in our office, the neurological adjusting activates the brain to work better, to activate the immune system better. So sometimes kids will come in with this low-grade fever, they'll get adjusted. All of a sudden that night, the fever will spike really high, but then the next day it drops off and it goes away. The reason for this is that we just activated the immune system. If we activate the fever really high, the bells ring, the firefighters go out, they fight it off, and they get through it. So the importance of letting a fever run is really important for a couple reasons. Number one, it's going to help you get through this current sickness more quickly. But number two, it's going to give your child a better advantage in the future. So when we talk about the immune system, and if we think of it, like I said, as these firefighters, your child's body isn't just born with great, really strong firefighters who know all the situations and always know what to do. It actually takes a number of years of encountering different types of bugs and different situations for your child's immune system to get stronger and stronger and stronger and stronger. Just like your first day in the fire department, you're not going to go out and fight like the biggest, scariest fire out there. You're probably going to sit back and observe till you get more experience. So what happens is if the fevers never get a chance to go high and they're always low, what happens is the immune system never gets a chance to really learn how to fight in a strong way. And that's why these colds and this congestion, all this stuff can just linger and become over and over and over this recurring thing. So that's the purpose of a fever in the moment to fight things off, and long term to help your body learn how to have a strong immune system and fight the next thing off even better. So, as I said then, the next big question is, what about the danger of a fever? It's a common thing that we get in our office. So this handout here, if you want it more specifically, just message in the comments. We'll be happy to post it or message it out to you. But this is some different facts and myths about fever, and it's actually put together by a couple resources here I put on the slide. Dr. Schmidt, he's a professor of pediatrics at the University of Colorado School of Medicine. He's a medical director at one of the children's hospitals in Colorado. And then there's some things here from Seattle's Children's Hospital. Now, the cool thing with this is it actually talks about why you shouldn't reduce a fever. So I explained some of those things already. But the next piece then is, well, what about the danger of a fever? And there was a study back in the mid-'80s in the Journal of Pediatrics, and a bunch of pediatricians got together and they're wondering, well, what about seizures? We know that a febrile seizure is something that is always a concern if the fever gets too high. And when they started looking into things, what they realized, they at first thought the seizure was because something in the brain was being damaged or malfunctioning. But what they realized is that the immune system uses a lot of calcium in the body. And if the immune system uses up a whole bunch of calcium, it starts to deplete the system and deplete specifically the muscles, and would actually throw them into like this tetany seizure-like response. So what they realized is that a febrile seizure was actually from a lack of calcium, not because of some damage happening in the brain. And so in this handout here from Dr. Schmidt, what he talks about is the fact that a seizure here is, they'll stop within a few minutes, they don't cause any permanent harm, nor do they increase the risk for things like speech delays, learning problems, or even future seizures. So I think the thing I want to emphasize is here, I'm not saying like, oh, yep, it's going to be great to watch your child potentially get a fever so high they have a seizure. But the point with this is, if you want to push the limits, I know a lot of parents, as soon as the fever goes up a little, they want to lower it right away. But basically with this, I want to give you permission to push the limits a little bit more. Let your child's body run that course, because what they found is that although it's not fun and although it's uncomfortable, things are actually going to be okay. They said that even fever, they talk about this 104 point here, that fevers above 104 can be especially dangerous or cause brain damage, and they said that's actually a myth. Really, that it's just the increased temperature is just the body's working harder with the fever, and that it's really has to get pretty high. Like, they rarely go above a high enough point of, they say really 108 might be the time where it can actually cause damage, which is super high. I don't know if I've ever heard of a child actually getting that high. They say basically to get high enough to 108, you probably have to be like locked in a stuffy car. So if you want this handout, definitely reach out. But the point is that the body is really, really smart, and it's not going to put in a built-in design of something that's going to cause damage in the future. So keep that in mind when you're talking about fevers, and hopefully for you as a parent, it gives you some empowerment to know that, all right, keep your child hydrated, maybe give them some extra calcium, something like that in their body to help support them, and they're really going to do okay. So the last piece then that comes with being sick, I know I experienced this, is being kind of moody, right? Because you get grumpy and ornery when your body's not feeling well. And what I wanted to mention about this is, really, this again is part of that natural design, because the immune system takes a huge amount of energy. So what happens is, if you're starting to fight a bug and you're feeling kind of tired, it's because your body's starting to take this energy away from your normal day-to-day, or maybe it's your child studying or playing on the playground, whatever it is, and it's starting to shift that energy towards the immune system. The more the immune system's working, the more energy it has to shift in that direction. So what happens is, if you're not fighting any bug, you have all this energy. If you start to fight a bug, that energy starts to drop. So the key here is to know that it's okay to rest. A lot of times we'll tell parents, you know what, if your child's been doing pretty well and they're not been, and you want to help support them from missing a bunch of school, maybe give them permission to rest a little bit early on. Not make them wait till they get all the way sick and then take a sick day. But if you see them start to drop and you know what, they're just kind of struggling, give them permission to take what we call a well day to try to stay well instead of waiting till you get sick. The other thing you can do, aside from that sleep and that rest, is support the immune system with low energy things. So the nice thing with drinking fluids, water, bone broths, teas, as I mentioned, is they don't take as much energy for your digestion, because your digestion is another thing that can use a lot of energy. So when you're sick, that's why you naturally don't crave certain foods, right? You might crave more, like, I remember when I was a kid, my mom would make toast, right? Because it's already ground up, it's a lot easier to digest. Other things, as you see here, is if you steam or cook your veggies, they're way easier to digest than cold raw veggies. Something I talked about a few weeks ago in an interview with Senya May, so feel free to look that one up. She talked a lot about more strategies too when you actually are sick, how to get through it, versus on this webinar we're talking more about how do you prevent this cycle from going over and over and over again. So free up energy for your immune system with lots of rest and things that are easy to digest in your body. Probably don't want to go out and have a big steak while you're sick, right? You're naturally not going to crave something like that because the digestion takes a lot of energy. All right. So then the last part here is we've been talking about some of these different symptoms and what they're there for, how to support the body so they can actually be stronger in the future, is what about what actually controls the immune system? So before we said the immune system has one part that tries to keep things out and another arm that if it is in, what to do about it. Well, here's the deal. If we actually step back to say what actually tells the immune system to ring the alarms or fight the bugs off, it's the nervous system. So the brain and the nervous system control everything in the body, and the brain and the nervous system have two arms as well. There's one that when you're under stress and you're go, 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 go all the time, that raises that gas pedal. There's another arm of the nervous system that, if you can go and calm down at the end of the day, helps you eat your dinner, slow down, rest, digest, get a good night's sleep. And that part is actually what also gives your immune system lots of power. So for a lot of us, what we see is this imbalance. We're in go, go, go mode. Your kids might be in lots of activities. They might be in, have homework. They might be in after school debate and soccer and piano and all these things. And they're go, go, go all the time. And what will happen is it shifts these resources of the nervous system away from the immune system and into just dealing with this day-to-day stress. So what we do in our office with the neurological chiropractic is we help to bring that back into balance. If you've ever noticed, for yourself or your child, when you're really, really stressed, a lot of times you actually don't get sick then, right? It's only when you get to winter break or you get to past your project that your body kind of crashes and then gets sick. I remember when I was moving in a couple of years ago, we moved to a new office, and I had 2 months where I was working around the clock. And we got the new office set up, got everything moved in. I got through that first week of work, and Thursday night, Dr. Chelsea adjusted me. I went home, and all of a sudden I started throwing up. I got this horrible fever, and I slept all the next day. It's like my body was knowing, it's like it held up long enough. Go, 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 go. As soon as I let down, boom, it crashed. All those resources went into my immune system. I got really sick, but the good news is because I let my body express itself, a day or two later, I had to do a lot of sleeping, but I got through it. So know that a lot of the kids that we see, when we assess their nervous system, what we find is that there's these stresses that have been built up and their gas pedal is stuck on internally. And what that means is that these resources have been chronically shifted to be taken away from the immune system and stuck in this stress mode. And so what happens is they get a little bit of sick, but they can't express it to get it out. They get the sickness that starts here, and if it doesn't drain, like I said before, the fluid, it stays stuck in the ear infections. It stays stuck in the tonsils or the adenoids. Maybe they have to get those pulled, whatever it is. Everything gets stuck and stagnant because the immune system never got the resources to be strong and fight really hard the way it's designed to. So if that's something, when you're hearing these different stories, these situations, if that's resonating, know that there are solutions out there. One of the families that we just started seeing, she might even be watching this webinar. I think I saw her register for it. She has a little girl that she said what would always happen is she'll get colds, and then it'll drain, and then she'll get croup. She'll have to be put on a nebulizer, and it just sees this horrible pattern. So she's just a few weeks into care, and she got her normal cold, and mom's kind of like, oh, I know what's going to happen. But guess what? This normal cold drained more quickly than usual. Her cough was productive. She actually started to get it out, and it didn't turn into croup. So mom's like, whoa, within a few weeks, she's already noticing this trend, and this pattern is starting to break. And now she knows that her daughter's body is getting the resources to actually do what it's supposed to do and get rid of these things, because her siblings aren't always sick all the time. So she's able to feel this sense of hope and empowerment and excitement that, you know what, there actually is something that can be done. So as we wrap up here today, just know that our office is definitely here for you. We're in this winter time. We know it's a busy time of year, but we also know that life is busier when you have to deal with a sick kid. I know as a parent, you only have so many resources to get through the day. So please start to apply some of the strategies that I've talked about here. And if you really feel like, yeah, my child has just been stuck in this cycle over and over, no matter what I do, I can't get out of it, odds are their nervous system is in that imbalanced state. And that's what we do in our office, is assess, yep, if it's in that imbalanced state, we help to balance it out, give the body the resources to be strong and powerful like it's designed to do. So please reach out if we can help. Feel free to give us a call, shoot us a direct message, and also if you have any questions, reach out as well. And I look forward to helping you guys any way we can. It's really something we love to do in our office. And I'll talk to you guys soon. Take care.